Okay, I think we're ready to start. Hello, everybody. My name is Marjan. I'm psychotherapist at My Therapy NYC, and welcome to my webinar on psychedelic-assisted therapy. Together, we are going to explore the origins and diversity of psychedelics. Then we're going to look a little bit at the effects of the nervous system. Well, what happens when you actually are on psychedelics? And that is going to then set the stage for the therapy itself. So what are the benefits of therapy once we take the psychedelics? If you have any questions during the presentations, please, I invite you to use the chat function and just type them in. We're going to have a dedicated section at the end when I'm going to try to answer your questions. But that's not going to be the end. At the end, I'm going to invite my colleague Clarice. She will have some giveaways for you, so please stay tuned. Okay, with that in mind, I think we can start. There is a lot of information on psychedelics out there. Sometimes it might not be so easy to tell whether what you're reading or hearing about psychedelics is actually a fact or a fiction. For example, psychedelic-assisted therapy always leads to hallucinations. Let's ponder this for a moment. So I'm going to invite you to use the polling and try to provide your answers here. So I'm going to give you a couple of seconds so you can use the poll here that you should see on the screen, and you can provide your answers. Do you think psychedelic therapy leads to hallucinations? Do you believe this is a fact or a fiction? It seems that most of you believe that therapy usually does not lead to hallucinations. That is correct, right? The doses that we typically use in therapy are much lower. There may be some typical or atypical perceptual experiences, right? But rarely that they use actually do hallucinations, right? This is usually more the case when people use psychedelics in the context of the retreats and so on. Psychedelic therapy is dangerous and highly addictive. So again, I invite you to use the polling and try to decide whether you believe this is a fact or a fiction. It seems that the majority of you believe that therapy is not dangerous, not addictive, and that is correct, right? If you rank all the different substances that people use, whether legal or illegal, then alcohol and tobacco usually rank way up at the top, right? And psychedelic usually at the bottom. For example, psilocybin, traditionally in most studies conducted, is one of the safest substances, right? In terms of addictivity, psychedelics are not addictive. There is no such thing as craving your next dose of psilocybin, just like you're craving a smoke, right? So these are not addictive substances. Psychedelic therapy can be safely conducted without professional supervision or guidance. What do we think, fact or fiction? Okay, yes. It seems that most of you acknowledge the requirement of supervision. Absolutely. As we're going to talk about a bit later, right, there is a lot to be said about the set and setting, the therapeutic connection with the person. And in this kind of environment, the psychedelic effects are very different compared to when you take psychedelics without the supervision. Right? Supervision and guidance is of paramount importance. Psychedelic therapy often involves the use of substances such as psilocybin or MDMA administered in controlled settings. Yes, I think this was the easy one. Most of you are familiar. So these substances, yes, are administered in controlled settings. Although right now we do not have FDA approval for either psilocybin and MDMA, right? There's a lot of clinical trials where, you can participate under controlled settings. Okay. I think one more. Psychedelic therapy is only effective for certain types of people or specific conditions. Again, I'm going to ask you to use the poll. Okay, some divided opinions here, right? It is true, right, that the screening is important, and there are certain criteria that can exclude you, and we're going to cover this a bit more in detail later, right? And yes, it's true that in the clinical trials, at least, the conditions such as depression, anxiety have mostly been, studied. However, there is an overwhelming evidence that they can be beneficial to most people, increasing, well-being, increasing the insight, increasing, your connectedness with nature, with God even, right? So it is for most people. However, I will stress, right, that the screening is important here because there are some conditions that are contraindicated. So we are in New York City discussing psychedelics in 2024. But how did it all start? What are the origins of psychedelics?
In many cultures, psychedelics have been used in rites of passage and to gain wisdom, usually administered in specific religious and healing ceremonies. In North America, some indigenous peoples use peyote, a cactus that grows in northern Mexico and a small region of South Texas.
I'm Adrian Primo. I come from 5 generations of peyote people, myself being the 6th and then my son being the 7th generation. To me, peyote is a very intimate medicinal herb. We use it as a guide. We use it as a means to synchronize with the universe. My grandparents explained to me at a very young age that we could acquire any means of success through medicine and peyote if we approached it with the right intent.
Yes, psychedelics have been used for thousands of years in religious and spiritual ceremonies, right? We just, in quotation marks, discovered them relatively recently in the Western society, but they have been around for a very long time. Perhaps a word about nomenclature. Although the word psychedelics is most frequently used, there are other terms such as hallucinogens, psychotomimetics, entheogens you might come across, right? And there is no clear definition of which substances fall into different categories. So for the purposes of this webinar, we're going to stick to the psychedelics terminology. When psychedelics were originally discovered, it all started really with Albert Hofmann, with the discovery of LSD. More than 1,000 clinical papers were published in the 50s and 60s, with more than 40,000 participants in clinical trials, right? So a lot has been done until the Controlled Substances Act in 1970, which put effectively a stop to all of that, right? For about 30, 40 years, there was almost like a psychedelic winter when nothing much happened. And only recently we started doing research on this type of psychedelics. There is a lot of psychedelics. In other words, there is a variety of psychedelics that one can think about and consider. For example, we have several psychedelics such as salvinorin, DMT, psilocybin, mescaline that are present in nature, either in mushrooms or in plants. And for example, DMT and psilocybin, mescaline share chemical structure and actually bind a similar receptor and act similar to serotonin. There is the other group of synthetic psychedelics such as ketamine, MDMA, and semi-synthetic LSD that have a bit different chemical structures, right? So among this diversity of psychedelics, which all have been now used in clinical trials, there are a few that make the furthest progress. So for example, ketamine is currently FDA approved, but MDMA and psilocybin are right next in the pipeline. We might get the approval even within this year for MDMA. So for the rest of the conversation, I'm going to focus on the psychedelics that are closer to being approved and you may actually use in your practice. So what is the current status? Ketamine, as I mentioned, has been approved with FDA for treatment-resistant depression. MDMA is very close. It might be approved very soon specifically for the PTSD, but as I'll mention later on, it also could be beneficial for the social anxiety. Psilocybin has been termed a breakthrough therapy for treatment-resistant depression and for some other conditions. So these three are really close to being put into practice, and ketamine is already being used. Whereas LSD, even though LSD is the molecule that started it all and is being extensively examined, it's not yet close to be approved. And then ayahuasca and ibogaine, research is ongoing, but regulatory approvals are pretty much limited. Few words about the ketamine, right? Ketamine was first synthesized in 1962. And it's very interesting, when ketamine was first discovered and when they found that it binds to NMDA receptors, the editors of Nature, which is one of the most prominent journals, were skeptical and felt that this is not exciting discovery enough, right? So it was rejected from the major paper and then published in another publication. It was originally approved as an anesthetic, right? An analgesic, and was actually used a lot in the wars. Later on, we discovered its potential actually in psychedelic-assisted therapy. And today, we have evidence that we can use it for treatment-resistant depression, PTSD, anxiety disorders, and also for some substance use disorders, all based on its ability to induce neuroplasticity. I'm going to say a bit more about neuroplasticity later. So ketamine is currently the only psychedelic that is actively being used in psychotherapy. MDMA, the street names being ecstasy, molly, and E, it's also being explored, even though it can also be, abused and plays a role somehow analogous to LSD in the 1960s, is structurally similar to amphetamine and mescaline. Mescaline is a substance found in the peyote cactus, and it's been particularly examined for its pro-social inducing behavior abilities, right? It holds therapeutic potential for PTSD and for social anxiety disorder. So this is where MDMA is being studied for, and it is believed that it could be approved as soon as the end of this year. Psilocybin is the third compound. Typically, when you talk to people about psilocybin, the word magic mushrooms come first to mind. It's been brought to Western culture in 1950s when certain explorers brought them from the Mexican societies, and isolated by Dr. Hoffman, the same person who isolated LSD. There's been a lot of studies on psilocybin, and it shows a lot of therapeutic promise specifically for depression, anxiety, addiction, and also end-of-life anxiety, right? But it's not been approved yet, but that might change. That might change very soon. Now, psychedelics exert their effects on the brain on different levels. It could be on the level of individual receptors, on the level of microcircuits, and on more network levels.
The default mode network activates when a person is introspective, and under normal circumstances becomes less active when a person shifts their attention to the outside world. But brain studies show that under the influence of a psychedelic, the default mode network is quieted, while other regions of the brain increase communication with each other. A mathematical model captures a normal brain's activity. In contrast, a brain under the influence of psilocybin reveals a dramatic increase in global communication. Thousands of new connections form, linking brain regions that don't normally talk to each other.
One analogy I've used for how psychedelics work in the brain is this snow globe. When you pick up a snow globe, the snow's settled at the bottom, it's sort of fixed, and then you pick it up, shake it, and things jiggle around, and there's randomness and a kind of chaos, if you want, in the system.
The user experiences this as an altered and heightened sense of awareness. But what causes this?
Early in our functional brain imaging studies of psychedelics, scientists were finding that the default mode network was turning down or turning off during these experiences. And that was a really good place to start. But we began to then look one layer deeper. Why was the default mode network turning off?
New research led neuroscientist Fred Barrett to investigate a region of the brain called the claustrum.
The claustrum is a really thin sheet of gray matter in the brain, tucked deep within each of the hemispheres of the brain. Recent animal models have shown that it is incredibly highly connected to just about every other region of the brain, understanding that the receptors targeted by psychedelic drugs are also really densely expressed in the claustrum. We began to wonder whether the claustrum may be at the center of psychedelic effects.
Fred believes the claustrum's central location and shape suggest it regulates communication between the departments.
When it's functioning normally, the claustrum is essentially acting like a switchboard. It's trying to help other brain regions figure out when to turn on and when to turn off. But when we experience a psychedelic drug, we believe that it's binding to specific receptors in the claustrum and somehow disrupting or disorganizing the claustrum. It's almost as if the switchboard walks away. What happens next is that we seem to observe a radical change in the way that brain regions talk to each other. And it may be within this context that we're experiencing learning and a possible even rewiring of the circuits that govern our behavior.
All right. So this was pretty much the presentation of the network type of effects, right? Even though this particular study was done with psilocybin, it is very interesting in other substances such as ketamine and MDMA that might bind to different receptors, nonetheless exert similar type of effects on the brain, right? They somehow inhibit or shut down the default mode network. And that's the hypothesis is contributes to the dissolution of the ego, right? Makes you more vulnerable. And then other areas of the brain that were not communicating before start to form new connections. In other words, all those chemicals seems to be converging on the dendrites, this part of neurons that they start forming new connections, new insights can potentially form. And this is kind of like a gold mine that we are trying to capture here, right? So to take the psychedelics, there's this window of new plasticity when new connections are formed, and you can kind of use this opportunity to then do the therapeutic work with your client. So this is kind of underlines and set the stage for the therapy. Now, people nowadays can get psychedelic experience in one of different ways. One way, for example, is the retreats. Since psychedelics, except for ketamine, are all still illegal, right? You can get to those retreats. The typical ones that are known are ayahuasca, for example, in Central America, where usually the higher doses of psychedelics are taken. This, of course, brings with its own set of safety considerations, right? Nonetheless, you know, there are clients who have had that experiences and want to come to the psychedelic-assisted therapy and explore that experiences further. Another way of experiencing psychedelics is through microdosing. This has been pretty popular recently. This is the usage of subperceptual doses that do not result in hallucinations, right? There is a lot of skepticism about the benefits of that, and of course, safety considerations because it's not done under supervision. But the recent study in Nature that studied microdosing in a very controlled environment found very little benefits. And it's unclear at this point if microdosing actually does confer any benefits. Nonetheless, clients who are involved in microdosing might want to explore this within the context of psychedelic-assisted therapy, right? The proper way, I would say, right, and under the proper guidance to actually take a full advantage of psychedelics is, of course, it's psychedelic-assisted therapy, which is what I'm going to focus on for the rest of the seminar, right? And as mentioned earlier, it was really in the 1950s and 60s there was the proliferation of studies on psychedelics, and this is where the first models evolved. One model, psycholytic model, which developed in Europe, takes its basis in the psychoanalytic tradition of Sigmund Freud. People will typically take low to moderate doses of psychedelics and explore them across multiple sessions. The key here was the belief was that psychedelics dissolve the ego, lower defenses, and then you can access this information which was not accessible before, gaining new insights, perhaps regress to earlier stages of development, and perhaps even bring on some unconscious information. On the other side of Atlantic, here in America, the existential and humanistic schools of psychology were developed, and along with those lines, the psychedelic therapy model, which was based more on one or two higher doses of psychedelics, more profound experience, and then exploration of that experience, exploration of the insight, right? It was a bit less structured. There are also some specific models that have recently been tested, such as CBT model, where in preparation session with the client, you would discuss perhaps some negative conditions, some negative core beliefs, maladaptive beliefs. And then during the therapy session, perhaps those beliefs, you can see them in a different way. And then you don't consolidate this in integration session, perhaps to more permanently change those beliefs. This is the CBT model. I would say, however, in most clinical studies nowadays, the less structured therapeutic model is used, typically in 3 stages, as I'm going to describe, when we have a very non-judgmental, accepting stance to whatever happens during the psychedelic session is then material to be explored in the further sessions. So this is like the most popular model right now. So let's look at some of the most often types of sequencing. Screening, I'm going to elaborate on that, is the most important part to begin with, because as I mentioned earlier, not everybody is a candidate to psychedelic-assisted therapy. So it's important that the member of the medical team does the proper screening. This is typically followed by the preparation phase, right? When we discuss with the client what the intentions are, this is what comes into play here is the set and setting, which I'm going to talk about more. This is very important. Then it's psychedelic session phase, the actual administration of psychedelics, and the integration phase, we can last for a few weeks or months or longer, where you actually leverage what happened in the psychedelic session and then the window, sometimes called afterglow window, right after you've taken psychedelics, to actually do psychotherapeutic work. Few words about screening. This is again conducted by members of the medical team, and typically the individual with a family history of schizophrenia, psychosis, mania, or severe personality disorders, but also dissociative disorders or alcohol use disorders are excluded, right? So this is important to do a proper screening. Also, certain neurological illnesses or poor liver or kidney function can be a reason for concern. Also, the use of medications such as SSRIs. Remember, a lot of psychedelics affect directly or indirectly the concentration of serotonin in the brain. So it's important to consider what other medications the patients might be taking. It is very important that in the preparation session, a strong therapeutic alliance is formed. You know, if you get a sore throat and you go to a doctor and you get an antibiotic such as azithromycin or amoxicillin, it does not matter in what kind of set of mind you are. It does not matter if you have a good therapeutic alliance with your doctor, antibiotic is going to work. Psychedelics are very, very different, right? It has learned through many, many studies that the effect of psychedelic is heavily dependent on the set, on your expectations of the feeling of safety, of connectedness. So this is, I cannot stress how important that is, to have a strong therapeutic alliance before you even begin that, right? So in the preparation session, if this is a new client, you would review the patient's life, you know, to form that connection. You would encourage them to have a homework, to keep a journal, to track daily thoughts. You would discuss drug effects. Most important, build that feelings of safety, that the patients are comfortable with you. And also to build a plan for potentially challenging experience that can happen in therapeutic session, right? Oftentimes, music here provides also a nonverbal structure. I'm going to say more about music a little bit later on. Just to demonstrate how important the set or expectation is, I'm going to use a lower level perceptual effect, okay? So let's try this. Now, what do you see in this image? Most people being exposed to a rabbit would interpret this image as a rabbit. This image is ambiguous. It could be interpreted in one of two ways, either as a rabbit or as a duck. It turns out if I expose you to a duck, most of you would see in this image a duck. In other words, pre-exposure generates a certain perceptual set that makes you interpret ambiguous similar different ways. And this happens in your everyday life. You form constant expectations. As you're walking to a room or an office, you expect to see chairs and tables, not giraffes and elephants. And that helps you to process information faster. And this extends all the way to the cognitive processes and emotions, right? That's why it's so important that the patients walking into therapy have the proper mindset, proper expectations, the feelings of safety, because that largely determines the effects of psychedelics. So after the preparation and the dosing session, the integration session is then the crux of your work with the client, right? One of the first things you're going to do with the clients, you're going to recap the experience. During the experience itself, clients are typically not communicating with the therapist. They could have the eye shades, listen to some music, and they're directed to focus inward on their inner experiences, right? So there's not much direct communication with the therapist. However, in the integration session that follows, this is where you go back and you examine in details what happened during the session. So you do exploration, you do reflection, you encourage your clients to produce a written narrative. Psychedelic experience might produce emotions and feelings that are undescribable, right? Language is limited. We have only a certain set of words, maybe not enough to describe what we're feeling. So sometimes artwork is advantageous, you know, to even help with recollection of what happened during that session. Of course, you're going to access deeply the emotional processing, the new insights gained in that session, and importantly, connect them to the daily life, right? How do these insights help you achieve things that perhaps you couldn't achieve before? Perhaps in integration session, you can identify new motivations, new perspectives gained, right? Also, as I mentioned earlier during the preparation session, right, you would also at this point address challenges. Perhaps something happened during psychedelic experience that was not pleasant, and you want to share with your therapist, right? In summary, integration session really bridges what happened in that psychedelic experience with everyday life. I will now focus a little bit on the one specific psychedelic-assisted therapy, which is the ketamine-assisted therapy, right? Ketamine is currently the only psychedelic that is approved, right? And our group practice, My Therapy NYC, we are offering ketamine-assisted therapy. So I would just like to give you some information, but you're more than welcome to log into our site. We provide much more information on our website about the ketamine-assisted psychotherapy. The model we are using is kind of like a tripartite model: client, psychotherapist, and medical team. Members of the medical team will do the initial screening. They will provide the medication, right? Supervise the vitals. Remember, ketamine has originally been approved as an anesthetic, right? So it's important that we have members of medical team supervising that. And then psychotherapists will then be present during the preparation session. It is advantageous if this is a new client that you have several sessions to establish that alliance. You can then be present during the dosing, or it can be done remotely. And modalities can be either in person or virtual, so both is possible, right? So typical during the preparation session, you would go over the concerns, over the intents with the client, explain the possible side effects, build this real feeling of warmth, of connectedness, having the attitude that everything is connected, to be open, not judgmental to the experience, so its clients walk into the dosing session with the right mindset. This is very important, right? The dosing session follows, again, which can be done in the therapist's office, or it can be done at home with the help of a chaperone. Here, sometimes it's important that participants or clients, they bring perhaps some meaningful objects. They can even create like a little altar that maybe perhaps there some music is played. They want to feel comfortable. And then the dosing session will generally result in some reduction in verbal abilities. So clients usually don't talk during the sessions, right? And ketamine has some rapid effects, right? Rapid antidepressive effects, but it also promotes neuroplasticity, right? It opens this window, sometimes refers to as afterglow, when you have now this window of weeks, when you can really use that and work in the integration sessions to leverage that, to work on what was gained there. What are some of the insights, perhaps? What are some of the new motivations? Sometimes people find new meaning to the old experience. Sometimes people remember things they didn't remember before, right? So you have all this to work with in the integration session. Again, there is much more information about ketamine-assisted therapy on our website. You might wonder, why is it important to actually do individual therapy? Why not just take the ketamine, right? Yes, there is a short-term effect of the ketamine, right? But the really important part happens after, when you have that window, right? To provide the personalized support, somebody client feels safe with, right? So you can access all those emotions, right? That you can consolidate behavioral changes. Client might feel motivated to start behaviors they were resistant to start before, right? Their defenses might be lower, and we can capitalize to that, right? This is also opportunity, as I mentioned earlier, to address the underlying issues, perhaps some issues that emerge during psychedelic session, and to provide continued support, right? It's really bridging that psychedelic experience to their everyday life, because this is what clients want, right? They want to change their behavior in everyday lives. What are some of the benefits? One is the increased self-awareness. People typically start to learn about parts of the self that were unknown to them before, right? It contributes to emotional healing and reduce anxiety and depression. Oftentimes, this session can generate the enhanced creativity. People start seeing things in different perspective. Some things, perhaps, people could be like stuck, like this is the best word to use. People could be stuck in certain patterns, but now they start to find a new way, or they appreciate new ways, right? Spiritual growth, behavioral changes, and sometimes it can be also used for addiction and of like life anxiety treatment. I'm going to give you one concrete example of a client who held a long-felt grudge against his father, who passed away some time ago. And in the therapy session after session, little progress was made. So the patient was really, really stuck. And after the ketamine-assisted therapy, clients suddenly started feeling very differently towards his father, started to shifting his perspective, started to feeling more connected, even though it happened in the past, right? And was able to let go, that grudge against his father and move on and live life in the value direction. Yeah. With this slide, I am concluding our webinar, at least that part, and I'm providing you here with some resources. More resources will be emailed to you. Yeah, you're welcome to use them. And now I'm going to leave some room for your question, but that's not the end. I'm going to, at the end of the question section, invite Clarice, who will have some giveaways for you, some surprises, so please stay tuned for that. Okay. So let me check the chat. Okay. So how does psychedelic-assisted therapy compare to conventional treatments for mental health disorders? Okay, that's a great question, right? So I'm going to say the main thing to emphasize is the neuroplasticity, right? Neuroplasticity, which really kind of like puts together the effect of different psychedelics, even though they have different effects on neurons, brings them all together in opening that window for the new insights and exploration. I think this is the major advantage, right? Patients who are stuck, patients who are perhaps having those maladaptive beliefs can move forward. You know, oftentimes you hear comments that people have tried therapy for years and years and years, the talk therapy, and they're stuck and nothing is working. And after some sessions with the ketamine and exploration and integration, they finally see a movement forward, right? So I'm going to say this is the biggest benefit. Okay, let's see. How does the dose of psychedelics used in therapy compare to recreational doses? Okay, so typically, right, this varies, but typically the doses are lowered. But I think more important than the actual dosage, what is important is that compared to recreational types of usage, the set and setting is controlled. It's a controlled environment when you have a strong alliance with a therapist. And I think this is what really sets apart using psychedelics in a controlled versus recreational environment, right? The safe environment, the right mindset, this is what gives you the real benefit and support that you're provided. Okay, I think we have one more. How long do the therapeutic benefits of psychedelic-assisted therapy typically last? Okay, and this is a great question. Some effects might be immediate, right? Ketamine is known to relieve depression pretty rapidly. However, then the benefits can last from weeks to months, and some people report benefits even years after, right? I think this is then essential that after you have conducted your psychedelic dosing session, that you really explore this in the integration session, right? Because these benefits can then be really lasting and can really be consolidated. Lisa is asking, how many sessions should you have with therapists before introducing ketamine, right? So we recommend at least 3 sessions. If you are a new client, at least 3 sessions, right? But more could be also beneficial. And I have another question. There is a client who's been using ashwagandha gummies. Are you aware of benefits? Unfortunately, I am not. I could definitely look into it. If you send me an email, I'll be more than happy to look into it and try to explore it a little bit. But I am not aware of it. And then I have one more kind of like a question here or a comment. Thank you for the wonderful presentation. What happens if the client falls asleep and doesn't remember anything to journal in their psychedelic treatment? They're on psilocybin. Every references would be great. So I would here, right, encourage the client to try to remember what happens before the client fell asleep, right? That's one thing. Sleep itself could be changed, right? In that sleep, there could be dreams. Let's not forget that sometimes the benefits of psychotherapy are not immediately apparent, right? They can come after in the psychotherapy session. Right? Remember, there is this window where the new connections are still growing and forming. So a client can remember later on, right? And again, I could look further into it. You're welcome to send me an email and I can look further. I'm going to get back to it as well. Is this supported by insurance providers? Ketamine-assisted therapy, not directly, however, it could be covered with out-of-network benefits, the integration sessions, for example, with us. Difference between ketamine and natural psilocybin. Okay, that's an interesting question, right? You'll remember these molecules, for example, psilocybin. Psilocybin, it's an agonist of serotonergic receptors. So it stimulates the neurons that typically get serotonin input, right? Ketamine, on the other hand, it's a blocker of NMDA receptors. So they do very different things on neuronal level. However, they converge on the network level. They both seem to be like reducing this default mode network, allowing kind of the ego dissolution, lowering of the defenses, and dendritic growth, right? So on the neural level, they seem to be having very similar effects. However, not enough studies have been conducted to pinpoint what the peculiarity and the differences are at this point. So I think at this point, nobody would know exactly how to answer in detail this question. All right, I think I've answered all of them. Again, thank you so much for being here. And again, if you have any questions, you need more information, please come to our website. You can email me directly. I'll be more than happy to get back to you. Thank you again.